2, 3. Good evening, everyone. Welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Yes or no? Please put a message in the comment section. आवाज आ रही है या नहीं आ रही? Hello everyone. What's happening? What's happening, everyone? Is my voice coming? Yes or no? So that I can start this beautiful class. Hello everyone. Did you guys miss me? I hope is my voice coming. Yes. Is it coming? Yes or no? Good evening, Dr. Shubhangi, Dr. Shubham, Manish, so many amazing people. Vaibhav, yes. How is everyone? So how's everyone doing? Is everyone okay? How's everyone health? Is my voice coming? My name is Dr. Anand. This is our cardiology classes part 2. Thank you so much first of all the love and support. Yes, Shubhangi, I am good. How are you doing? Hello, Dr. Shubham. So sabne miss kiya. My name is Dr. Anand. I am MD Pediatrics. These sessions are basically for the students who are applying for our PG and UG exam. I'm assistant professor in a medical college with amazing teaching experience, and we teach to all the UG, PG, DM and MRCPCH students. The batches are segregated. If you wish to join, most welcome. Today's topic of choice, we're going to start about the amazing cardiology classes, and I hope everyone health is amazing. Good evening, Mariam, Farzana, Sona, Vikram. I'm good, Vikram. I'm good, bro. How are you doing? What's everyone doing? Yes. Very good to see you. So did you guys miss me? Saturday, Sunday, we didn't have any class. I had my night duty. That's why. Yes. Manish says I'm missing too. Same here, bro. I miss you all, everyone, so much. So let's start this amazing class now. So in this session, beautiful segment, we're going to continue the cardiology series and amazing crazy questions on cardiology. Our target is to finish the whole cardiology within the next 15 days. So one disease per day, we're going to finish it beautifully. Before starting any amazing segment, we always have a motivating quote, and today's motivating quote is: sometimes when you are in a dark place, you think you have been buried, but actually you have been planted. So sometimes, very beautiful, sometimes when you are in a dark place, you think you have been buried, but actually you have been planted. There will be a times in life when you feel little negative. There will be times in life when you feel that everything is not happening properly in my life. So don't feel negative. Very importantly, don't lose focus. जिंदगी भगवान की एक बहुत महंगी गिफ्ट है. सो वी हैव टू ग्रैब दिस अपॉर्चुनिटी. वी हैव टू बी हैप्पी, वेरी वेरी हैप्पी. ओके, रिमेंबर दैट. ओके, सो नो सैड बिजनेस, जस्ट बी हैप्पी एंड अमेजिंग. मेरे बाल गीले हैं. यस, माय हेयर्स आर लिटिल वेट बिकॉज आई जस्ट केम बैक फ्रॉम जिम. दैट्स व्हाई एवरीथिंग इज लुक लिटिल वेट. नेक्स्ट टॉपिक ऑफ चॉइस. यस, कैन वी प्लीज कंटिन्यू द सीरीज? यस. Ductus Arteriosus. In the previous class, very beautifully, we guys covered regarding the amazing, fetal circulation. Quick answers. Tell me, everyone. Put a good vibe in the class. Next 30 minutes, let's crazily finish it off. Dr. Mariam says, superb t-shirt. Thank you. Okay, great. Yes. So, Dr. Shubham, thank you for all the love and support. Everyone is just crazy here and we will rock. Ductus Arteriosus is very sensitive to three things. Can anyone answer in the comment section? Ductus Arteriosus. What is Ductus Arteriosus for the newcomers? Where it is present, Ductus Arteriosus? Everyone knows about it. So as we all know that this one basically this is the patent ductus arteriosus number 1, which is a left to right shunt number 1, which is a acyanotic congenital heart disease. So very importantly, beautifully, you must understand, once the baby is out, most importantly, the lungs start working. Yes or no? When the lungs are functioning, once the baby is out, the oxygen, basically oxygenation takes place, right? And oxygen is a very good smooth muscle constrictor. Oxygen is a very good smooth muscle constrictor. That is the first point we must understand. Okay, so oxygen is a very good smooth muscle constrictor. This is one reason why ductus arteriosus is slowly closing. So ductus arteriosus, yes, it is sensitive to oxygen. Yes, it is sensitive to bradykinin. And as we all know, in the mummy's tummy, yes, placenta secretes PGE2. Placenta secretes PGE2. जो क्या करता है? What it does? Placenta helps in keeping the ductus arteriosus open. Placenta secretes PGE2, which helps in the keeping the ductus arteriosus open. So in the fetal circulation A, B, and C, oxygen, bradykinin, and PGE2 is really very important because it is very sensitive to ductus arteriosus. Okay. Remember, put the good vibes in the class. Okay, if you are a newcomer, amazing, most welcome. If you're an old comer, revise. The whole journey, see, it's all about revision. Okay, it's all about revision. Out of 10, 7 students come and tell that, sir, I read it I read it nicely, but once I went in the exam, I forgot. I remember you have told that question, I remember the option also, but that exact answer I forgot. So revision is the key, bro. Just my classes every day you attend for 30 minutes, your whole book will be covered on a 360-degree angle. Next question, please. Ooh, transitions. I love transitions. Okay. Yeah, so this we have already covered. The ductus arteriosus is very sensitive to 3 things. We know that it is oxygen, it is bradykinin, and who else? It is nothing but PGE2 is very sensitive to. This part I hope we have covered. Next important question, let's cover it in a very beautiful way. Yes, we have the remnants. Remnants are really important, bro. It has come multiple times in exam. Very quick answers, please. A or B. The remnant of ductus arteriosus is what? Ligamentum venosum or ligamentum arteriosum? Who will tell me any random guesses? A, B, too quick. A, B, options answer, finish it off. The remnant of ductus arteriosus is nothing but ligamentum arteriosum. Number 1, very perfect answer. Yeah, Dr. Shubham says, I like that bird. Really? I thought you liked Dr. Anand lecture. I'm just kidding. Yes, exactly. So perfect. The remnant of ductus arteriosus is ligamentum arteriosum. Ye ligamentum venosum is a remnant of what, bro? Can you please tell me? Dr. Shubhangi, Osama, Grace. We have Grace also. We have Simranjeet, Vikram. Amazing people today. Great. So the remnant of ductus venosus is nothing but ligamentum venosum. The remnant of ductus arteriosus is ligamentum arteriosum. This part is perfectly covered. Very important FMG and PG question. I would like to ask ductus arteriosus. Can you please tell me functional and anatomical closure? Can you please tell me functional and anatomical closure of ductus arteriosus? कोई बता सकता है मुझे? Yes or no? Exactly. In how many hours and how many days we have the functional and the anatomical closure of the ductus arteriosus? Anyone? Exactly. Very good. It's so beautiful. People are like amazing here. Exactly. So please remember the functional and anatomical closure of the ductus arteriosus. See, it's a basic one. Remember 15. Yes, exactly. Very good. The functional closure happens in 10 to 15 hours. And anatomical closure happens in 10 to 21 days. Vaibhav Sharma, perfect answer. Perfect answer. Okay. Very good. Very good. आज जिम में मेरा थाइस था, थाई एक्सरसाइज था. Oh my goodness, today was amazing, amazing. My instructor says you are doing really good, Dr. Anand. Please come, continue gym, inspire people, and just be happy. Yeah. I hope you guys are inspiring in your life also. I want you all to be a very good source of inspiration. Life is just one. Be strong, be amazing. Ups and downs will come, but you should never shake. You should be constant. Your energy should be constant. You say yourself, you are an amazing soul. You are a perfect soul. Tell yourself every day. And if you forget, या माथे पे लिख लो अपने, याद आ जाएगा शीशा देख के. Okay, perfect. So this is the very important question, my dear friends. Ductus arteriosus, the functional closure happens in 10 to 15 hours and anatomical closure in 10 to 21 days. Star mark. This is already been a repeated FMG question. Next question, please. Sir, umbilical artery, sir. Could you please tell me? I always forget, yaar. I always forget this one. Umbilical artery. Can anyone tell me what is the remnant of umbilical artery? Is it medial umbilical ligament? And it is ligamentum venosum. Beautiful. Good vibes. Can we please have good vibes in the class? Good vibes. Good vibes. Good vibes. Yes, exactly. या ओके. मनीष कह रहा सर मेरी बाइसेप्स थी और मेरे बाइसेप्स नहीं थे तब भी 15.5 inch is okay. That's right, bro. So the umbilical artery, can we please just finish it off the whole book only? Umbilical artery remnant, dear, we all know that medial umbilical ligament. Good vibes. Medial umbilical ligament, bro, please remember. Okay, umbilical artery remnant is medial umbilical ligament. भूलना नहीं है. Imagine, bro, you're reading this for the first and last time. That's it. Okay, close the book, just talk to me and finish the whole book. Okay, umbilical artery remnant is medial umbilical ligament, right? Ooh, transitions. I like it. Nice. Umbilical vein, sir. Medial artery, umbilical artery. You told medial umbilical ligament. Can you please tell me umbilical vein? What is the remnant? Obviously, sounds a very easy option to me. Ligamentum teres hepatis. Ligamentum teres hepatis. Very good, Dr. Shivani. Mera pyara bhai Shubham. Yes, exactly. And we have Bhavna, Farzana, Ashish, Zahra, Parveen. So many amazing people we have today. Great. Umbilical vein. Hello. Umbilical vein remnant. Ligamentum teres hepatis. Ligamentum teres hepatis. Could you please tell me ये कहाँ पे होता है? Where, which ligament is connected to this one? Ligamentum teres hepatis is connected to which organ? Brain, kidney, liver. Any random guesses? Yes, Dr. Simranjeet Mariam Zahara has right. So basically, it is a ligament basically present over the liver. Ligamentum teres hepatis is one of the ligament which is present over the. It's connected to the liver. Liver is a very important answer. Okay, done. So good vibes. Remnant of ductus arteriosus, ligamentum arteriosum. Remnant of umbilical artery, medial umbilical ligament. Remnant of umbilical vein, ligamentum teres hepatis, and remnant of ductus venosus is ligamentum venosum. Ligamentum venosum. Yes, perfect. Can we please finish this? I know everything. I am a superman, superman. Yes, and remnant of foramen ovale. Very easy question. Oscar को भी आता है. Oscar is my doggy. Oscar, what is the remnant of foramen ovale? I think he knows it. So the remnant of foramen ovale, everyone knows about it. It's nothing but fossa ovalis. Exactly. Fossa ovalis sounds a very beautiful answer. Okay, next one, please. The remnants are over. Now we have functional and anatomical closure. We gonna cover cardiology like crazy. In the next 15 days, our target is to finish whole cardiology from A to Z. Okay, from A to Z. Okay. Any doubt anyone has, you have my mobile number already. My mobile number is 9999897081. We are making a list. We are recently making a list of the important topics in pediatrics. If you feel any topic you feel you want to revise, nephrotic syndrome, renal tubular acidosis, ambiguous genitalia, you name it and you get it. Okay, congenital adrenal hyperplasia, easiest topic on this planet. So anyone having any doubt, you want to revise any specific topic, put in the, come to the WhatsApp and tell me. Okay, because comment section sometimes it's difficult to remember and read. Perfect. हाँ जी, अब आ जाओ फंक्शनल एंड एनाटॉमिकल क्लोजर. डक्टस आर्टरियोसिस तो मैंने पढ़ लिया. 10 to 15 hours फंक्शनल क्लोजर एंड 10 to 21 days anatomical closure. This everyone knows now. I agree with you. Next, Dr. Mariam and our dear Shubhangi Kaushik. Ductus vinosus. Can you please tell me the functional and anatomical closure of ductus vinosus? A tough one. Can you please answer? Now the students will say, please option. Can you please give me option? Without option, I don't feel like answer it. Okay, I'll give you option. These are the three options, bro. Ductus venosus, functional and anatomical closure. What do you think? Option number A, option number B, option number C. Can we have quick answers, please? Quick answers. Yes, very good. Vaibhav is answering so good. We have Vaibhav, Zahara. Yes, very good. Very good boy. Yeah, exactly. See, बहुत easy है, बहुत easy है. I'll tell you one thing. As you know, right, that we have this baby was there and we had the placenta, right? And we know that the deoxygenated blood basically comes from the baby to the placenta with the help of umbilical artery, and the fresh blood enters from the placenta to the baby by the help of umbilical vein. The first organ it touches is the liver. Yes or no? So that's what. And here only we have the ductus venosus, right? So this is the first one to get closed. Like ductus venosus, the functional closure is after the removal of placenta or just after cord clamp and cut. Will you remember this for me? Yes or no, please? Zahara, Dr. Shubhangi, will you remember this, my dear? Exactly. Ductus venosus, basically, just it is so near. Are you understanding? It is very near to the placenta. The first thing, just after the removal of placenta or umbilical cord clamp, the first thing functional closure happens is of ductus venosus, and within 1 week the anatomical closure takes place. Okay, so I hope you guys did know it. Now two things we have covered. Okay, ductus arteriosus and ductus venosus. Ductus arteriosus का क्या था? Functional and anatomical closure. The ductus arteriosus functional closure was 10 to 15 hours and anatomical closure was 10 to 21 days, and ductus venosus just after the removal of placenta and anatomical closure in 7 days. 7 days finish. Okay, perfect. Okay, let's go further. Ductus arteriosus. Ductus arteriosus, just now we covered, I've already told you, 10 to 15 hours is the functional closure and 10 to 21 days is the anatomical closure. Very beautifully we're gonna cover, okay? Anyone has any doubt, you can ask me, okay? Exactly. Yes, Dr. Shubham says, sir, black वाला t-shirt आया क्या? Yes, black वाला t-shirt मैंने order किया है, तेरे को आज मैं डिजाइन भेजता हूँ. black वाला t-shirt 2 दिन में आ जाएगा, but पहले मैं तेरे को डिजाइन भेजूंगा, तू हाँ करेगा, तब मैं उसको ऑर्डर करूंगा. Next question please. Exactly. So now very beautifully see, ductus venosus over. Just now I told you, after removal of placenta and anatomical closure in 7 days, ductus arteriosus over 10 to 15 hours and 10 to 21 days. These two things I assume we all know that. We all are like one family, and it's my duty to share and transmit my knowledge to you so that we can, beautifully help the mankind. So now we are left with foramen ovale. Can you please answer in the comment section? Or we have two options. Double star mark is a super speciality question, and we have a lot of MD students also in our group. So anyone applying for super speciality, yes, please now see foramen ovale, functional closure and anatomical closure, right? So functional closure of the foramen, option number A and option number B. Can you please answer in the comment section, please? क्या लगता है आपको? Anyone? What do you think, guys? Anyone? You have 5 seconds to answer this question. Yes, very good. So foramen ovale, my dear, foramen ovale, the best answer is during breastfeeding. The functional closure of the foramen ovale, Vaibhav, remember dear, functional closure of the foramen ovale that happens in during breastfeeding. Foramen ovale, okay, and it takes months to years for the anatomical closure. Very important question, guys. This we keep forgetting, okay? Okay? So please remember, my dear friends, okay? Okay, next one, please. Yes, okay. So yes, this part is over. Next one we have is umbilical artery. Okay, if I don't give you option, can you please tell me? I'll give you a chocolate. Today only we had a Delhi class. Last 3 days also I was busy in my Delhi class. Anyone want to come to my live classes? Like this month we have another class in Delhi. And next month we have a class in Jaipur, and then the next month we have a class in Hyderabad. Okay, so 3 months we have classes, guys. If anyone from Delhi can come. In July I have a class in Delhi, the live classes, offline classes. In August I have a class in Jaipur, and September I have a class in Hyderabad. So you want to enroll, you can just WhatsApp me. I'll tell you the specific dates. Umbilical artery, okay, umbilical artery, functional and anatomical closure. What do you think, guys? Yes, umbilical artery, basically the functional closure is spontaneous and anatomical closure takes around 2 to 3 months. Very good, Meta Zillo, very right, madam. So beautifully answered by Dr. Dev. Amrit आ गया कोलकाता में बैच भी बनाया नहीं है. I have not made a batch in Kolkata, but I think once we talk, Amrit, then we'll definitely have a batch. Okay, मुझे WhatsApp कर. And Dr. Anand Shashri, come to Chennai. Yeah, definitely, let's make a batch in Chennai and Kolkata. We'll collect students, but this month already I finished up. Today was the last class of my Delhi class. On 23, 24, 25 of this month I have another class in Delhi. Next month in Jaipur, next month in Hyderabad. Like this, we're gonna cover the whole planet. We have a class outside India also. So we're gonna rock. Do you want to rock? Do you want to rock? Yes or no? Yes. Ductus arteriosus closure occurs through what? Very beautiful question. Can you please answer in comment section? Exactly. Yeah. So Amrit, send me your mobile number. We will contact and let's make a batch. Pakka. ठीक है. चलो जी. हाँ जी. Assam, perfect. Very good. Yeah. So yes, Dr. Shubham, I'll tell you. So we have the classes slot 23, 24, 25 this month in Delhi. Ductus arteriosus closure through what? I don't know. I have no idea about this. Ductus arteriosus closure occurs through what? A rise in oxygen. Will it cause a closure of ductus arteriosus? Yes, sir. You only told, na? The lungs are working, oxygen is coming, and oxygen is a smooth muscle constrictor. Yes or no? So this sounds good option. And also at the same time, fall in PGE2 levels also. है ना? Placenta got cut. See, I'm trying to ask you question in every level, okay? Every way. I'm trying to ask the question in 360-degree angle. Topic is the same, but I'm asking you so many questions so that by the end of this topic you are PhD holder in fetal circulation. Next question please. Yes, very nice question. One second, इसको मैंने option change कर दिया ना. Vein, venosus, arterios, Okay, what do you think? A or B? Anyone can answer in the comment section. A or B? Because because the cute part is B, C, D both are same. Both are same. So एक दो option बनते हैं. Is option number A is correct or option number B is correct? Today also in my Delhi Gautam Nagar class, student were asking this, sir, order of closure क्या होगा करके. This is the latest guidelines. Okay, Bhavna says C. Specifically C. Why not D? Why not B? Because B, C, D both are same. A and B are different. हाँ जी, yes exactly. मेरे बाल सूख गए. Yes, yes, very good. Perfect. The best answer, the latest answer for this question. Yes, we have Dr. Grace, Faizan, Priya, Pandey, Manish, our Shubham. Yes, beautiful answer. The best answer for this nowadays we have VFA. This is an important question, my dear friends. Because previously the mnemonic was different, the order of closure was different. You might have written in your notes the order of closure previously was UVA F, like the mnemonic we had. But now just remember, bro, VFA, VFA, VFA. Yes, exactly. Sir, V से क्या बोला आपने? Ductus vinosus. Do you remember, dear? I told you, bro. Just now I told you, no? Because ductus vinosus is. Do you remember? I told you ductus vinosus is just near to the placenta, my dear. Number one, ductus vinosus closes first. Number one. फिर ऊपर कौन आता है? You go little up in the heart, foramen ovale. Yes or no? Can you imagine, please? Can we have a beautiful photographic memory, my dear friends? Please. First closure is ductus vinosus. You go little up in the heart. What do you have? Foramen ovale. Do you remember foramen ovale, where the blood from the right atrium goes to the left atrium, and down part, what do you have? You have ductus arteriosus. Ductus arteriosus. And remember, as everyone knows, ductus arteriosus is a in the mummy's tummy. In the mummy's tummy, it is a right to left shunt. And once the baby is out, it is a left to right shunt. Do you agree with me? Yes or no? Do you remember that, bro? Revision, my dear friends. That's why I'm having this everyday live classes, so that we all can connect, we can breathe together, be together, and feel together. Has everyone understood this much? 30 minutes of class is over. 10 more minutes left. Yes or no? Yes or no? Vaibhav, umbilical vein इसमें आती नहीं है, dear. Umbilical vein has plus minus. That is why we'll only keep the answer till this much. Exactly. Has everyone understood? Yes. Please let me know. Please put a like button so that I can continue further. Very good. तेरे चेहरे से नजर नहीं हटती, नजारे हम क्या देखें. Exactly. Very good question. Now this was a recent question. You might be doing little wrong in this one. Let's see, guys. Let's put good vibes. Drug of choice for congestive heart failure in a pediatric age group. Okay. Drug of choice for congestive heart failure in pediatric age group. Anyone? Yes. The best answer for this question, Dr. Shubham, very good, brother. Yes. So the best answer for this question, you might please update in your notes. They are AC inhibitors. CCF, okay, CCF, very important, okay. Drug, एक बच्चे को अगर congestive cardiac failure हो जाए, pediatric age group, usually the drug of choice we use is ACE inhibitors. Can anyone please example? Can you please name some examples? Dr. Shubham, Ashish, Shubhangi, Vidyashri, Grace, so many people. Exactly, you're right, bro. So what are AC inhibitors? Any one example and one side effect. Yes. अच्छे से बताओगे तो मैं फार्मेकोलॉजी पढ़ा दूंगा अच्छे से. हाँ जी, बताओ पहले. Exactly. Have you heard of enalapril? Yes or no? We have enalapril, we have captopril. We have so many pills, right? Enalapril, captopril, lisinopril. Yes, exactly. Very good. And what is the side effect? What is the side effect of any one side effect? Any one important side effect of AC inhibitors? I remember in my this one. Yes, exactly. Oh, Dr. Zahid so beautifully he's answering. Very good. So yes, have you heard of persistent bradycuff? Persistent bradycuff. Very important. Persistent bradycuff. Yes or no? Exactly, that's true. Yeah, absence of substance P, that's right. So enalapril, captopril are the AC inhibitors, when persistent bradycuff is one of the common side effects of AC inhibitors. Perfect answer. Next question, please. Yeah, this is a good question. This is a nice question actually. Four-chambered heart. So beautiful. Mukesh is answering so nice. Captopril, enalapril. Perfect, bro. Perfect. Born perfect. Amazing people. Four chambered heart. Can you please beautifully answer this question? Four chambered structure of the heart develops by how many weeks of intrauterine life? We have the right atrium, right ventricle, and left atrium, left ventricle. Four chambered heart, mota mota, a proper four chambered heart or structure of the heart develops by how many weeks of life? Can anyone answer in the comment section? Super amazing answers by the people who are beautifully answering are Jitu, Shubhangi, Faizan, Sona, Priya, Amritsu, Vidyashri. Yes, the right answer is nothing but 6 weeks. That's very well put actually. By 6 weeks of life, फोर चैम्बर्ड स्ट्रक्चर ऑफ द हार्ट बन जाता है प्रॉपर एक बेबी का ना बाय 6 week ऑफ लाइफ फोर चैम्बर्ड स्ट्रक्चर ऑफ द हार्ट इज फॉर्म perfect very good next question please Ductus Arteriosus, such a beautiful question, guys. We are so lucky. See, it's all about MCQs, 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 because we have to get a rank 1 and we have to get to all the MCQs on this planet. Okay, yes. So Ductus Arteriosus, could you please tell me ये किसके बीच में होता है? मुझे तो याद ही नहीं है. I don't remember, bro. Anyone? Yes, Bhavna, Taku, Dr. Abdus Salam Khan, Abdus Salam. Yes, exactly. Dr. Amarnath, Shubham, Manish, and Pandey. Yes, very good. So beautiful answer. It is between the pulmonary artery and descending aorta. Pulmonary artery and descending. हमने बहुत बार किया है. Remember, guys. Okay, भूलना नहीं है इसको. You don't have to forget it. Okay, it's really important. Ductus arteriosus is the present between the pulmonary artery and descending aorta. Descending aorta, very important. Next question, please. This is a good one. This is a good one. How much blood enters the left atrium and how much blood enters the right ventricle? Like this question is in the fetal circulation. You remember, my dear friends, I told you that once the blood enters, from the superior and inferior vena cava, once it enters the right atrium, do you remember I told you that much of the blood goes to the left atrium? Yes or no? With the help of foramen ovale, which is S-shaped, which later form fossa ovalis. सवाल ये है that how much blood goes into the left atrium and how much blood goes into the right ventricle. Right ventricle. Quick answers, please. A B C D. A B C D. The options are 1/3 and 2/3, 2/3 and 1/3. Equal amount enters and none of the above. So amazing. We have super amazing toppers who are answering do this one. Exactly. Yeah. Perfect. Very good. Very good. Beautiful answer. Yes. The best answer for this question. See, it's very easy. We are first, okay. We are rank 1. We are rank 1 holders. Like, so 1/3. One will come first and then the 2 will come, okay. 1 will come first and then the second rank will come. So first rank 1. So first 1/3 of the blood, basically remember, it goes to the left atrium and 2/3 of the blood goes to the right ventricle. Right ventricle. So beautiful. Perfect, people. Perfect answer. We are amazing. That's it. Next question, please. Very easy question, guys. Very easy question. Please, these are amazing MCQs. It's just not for the PG, for the FMGs, INI, CET, and for our upcoming UPSC exam. They can ask you these questions. Can you please answer in the comment section, please? Exactly. Yeah. Total fetal cardiac output. Total fetal and neonatal. Fetal and सबसे छोटा fetus. Then we have the neonate, right? Fetus, then neonate. Exactly. Dr. Basant, Dr. Omaima Ali, nice name. Omaima is right. Basant, yes. Very good, very good, very good. Perfect answer, yes. Very beautiful biceps and very beautiful answer. Very good. Dr. Amritsu has a perfect answer. See, sabse chota, the smallest is the fetus, right? Go with a higher number. The smallest is the fetus. The answer is 450 ml per kg per minute is the fetal cardiac output. Then little bigger will be the neonate. Then it is 350 ml per kg per minute is the neonatal cardiac output, right? Yes, exactly. 450, 350, and also one thing I told you, 250. Can we please link and study 450, 350, 250? Can you please answer in the comment section? Dr. Indian Lovers, Zahid, Manish, beautiful. The total fetal cardiac output is 450 ml per kg per minute. The total neonatal cardiac output is 350 ml per kg per minute. And then we have in the Wilson disease. Yes, Dr. Shubhangi, very good. In the Wilson disease, which is the gold standard investigation of choice, Dr. Shubham, बेटा तूने आंसर नहीं किया, देख तेरा क्या करूंगा. हाँ, oh very good. Shubham is answering good. प्यारा बच्चा है हमारा, गुड. So the gold standard investigation of choice in a Wilson disease is liver biopsy. Exam question. Whatever word coming from my mouth, my dear friends, is an exam question. Okay. Yeah. Exactly. So yeah, the gold standard investigation of choice in a Wilson disease is liver biopsy. And liver biopsy में क्या देखेंगे? What will you see in the case of liver biopsy? In a case of liver biopsy, sir, I would like to see the hepatic copper content. Am I right or wrong? Hepatic copper content. Yeah, because copper everywhere, no? So how much hepatic copper content will be like a target if I say this is a positive for Wilson disease? My hepatic copper content, very importantly, 250 microgram, very importantly, 250 microgram, very important, remember, 250 microgram per gram dry weight of liver. 250 microgram per gram dry weight of liver of hepatic copper content is the diagnostic investigation of choice, is nothing but of the Wilson disease. Yeah. Dr. Sayak, because fetal has a more demand. Fetus has to do a lot of work. There's a ductus arteriosus open, foramen ovale open, everything is open. The demand of the fetus is more. That's why the cardiac output is more. Okay, so the best answer for this question is 250. That is very, very important. Acha, I have one more question. Okay, I hope you guys have got this one. Perfect. Chalo. Very good. Yeah, one more thing I had a question to ask you. Yeah, exactly. Could you please tell me what is a fetus? Can you define fetus for me? Anyone? Can we please define fetus? Very good, very good. Please answer in the comment section. Fetus क्या होता है? Do we have a proper definition? Anyone? Dr. Mariam, Dr. Omaima, Basant, Shivani, Mariam and Grace, Shubham, Simranjeet and Shubhangi Kaushik. What is fetus? What is the definition of fetus? Exact definition. Yes. The definition of fetus is 9 weeks till birth. 9 weeks till birth is known as fetus. What is ovum? Anyone? What is ovum? What is embryo and what is fetus? कोई बता सकता है? Anyone? Exactly. So beautiful answer. Amazing. You guys are rocking like crazy. Okay, beautiful answers. 0 to 2 weeks of gestation. 0 to 2 weeks of gestation is known as a ovum. Is known as a ovum. What is an embryo? Embryo from 3 weeks to 8 weeks. Okay, from 3 to 8 weeks is a embryo. Star mark. This was the exam question. 8 हफ्ते के बाद मतलब from 9 weeks till birth, that is a fetus. That is a fetus. Perfect. Okay, 0 to 2 weeks, 3 to 8 weeks, 9 weeks till birth. Ovum, embryo, fetus. Another 3 crazy questions. Over. Okay, great. This part is done. This part is done. Yes, very good. Very good. 1 second. Yeah. Okay. No, wait. I have to. What kind of tremors do you see in a case of Wilson disease? Can we please link and study? I want to get a rank 1. Please tell me what kind of tremors do you see in a case of Wilson disease? Anyone? Anyone? Exactly. Very good. So beautiful answers. Very good. What kind of tremors do you see in a case of Wilson disease? Do you have वो कुछ ऐसा होता है ना, ऐसे करता है तो like this the patient will do, like this the patient will do. He will not able to put like this. Okay, again he will do. What do you call this tremor like that the patient will do? He can't do like this. Okay, again his hand will go like that. Okay, what do you call this? Anyone? Yeah, this is known as, you can say, intention tremors, and also a beautiful answer will be wing beating tremors. Intention tremors are this one. Okay, intention tremor, if you give me a pen, if I take a pen, my hand starts shaking. Intention. Okay, if you give me a pen, my hand starts shaking. That's an intention tremors. And this one I can't do like this. Okay, again my hand going like this. Okay, so clinical knowledge, guys, clinical knowledge is crazy. I have made a video of 12 videos on each cranial nerve examination. In 2-3 days I'm going to post the videos on YouTube, like olfactory one day, optic one day, oculomotor one day, 10 days 10 cranial nerves over. Do you want that cranial nerve video? Yes or no? If you want, let me know. I will post it on the YouTube. Clinical knowledge, I want you guys to rock the burn the stage. Okay, and clinical knowledge is very, very beautiful. People, see, you must have something amazing in you. Okay, frankly speaking, you must have something amazing in you. This word there's a lot of struggle and there's a lot of competition, of course. So frankly, whatever you're studying or whatever you're doing, you should be good at your job. You should be genuinely good at your job. If you are good, people are gonna come to you. Okay, don't run. I always have this motto of life: don't run behind money. Don't run behind wanting to get rich. Okay, just be good at your job, and if you are good at your job, people are gonna come to you. It's as simple as that. Okay, exactly. ठीक है, perfect, great. Okay, next question please. 5 more minutes, then this class is over. Okay, I have this doubt. This was the PG question, NEET 2020. This question was, yeah, exactly. The question is, inferior vena cava IVC blood is dash saturated than the SVC blood in the fetal circulation. I have doubt. I don't know. Is it more saturated or it is less saturated? I always get confused. Anyone? Yes, exactly. Perfect. Okay, yes, exactly. Yes, Dr. Amritsu, I will share the t-shirt link also to you. Yes, brother. अपना number भेज Amrit. Are we friends on WhatsApp? Amrit, I have no idea. Let me know, please. Yeah. Mariam says, if you love us, please upload. Definitely, dear. I'll do it. There's no doubt about it. I'm gonna share all the amazing clinical knowledge, respiratory, cardio, but एक एक करके मैं करूँगा because I have hospital duty also. That's why. Okay. Yeah. Perfect. So the best answer for this question, we all know that IVC blood. See, you know that IVC blood will be more saturated than the SVC blood. You know, right? The oxygenated blood from the umbilical vein, once it enters the liver, it goes to the ductus venosus and then it enters the inferior vena cava. So that path, that blood, I think it is more saturated than the SVC blood. Are you understanding? So I hope you got it. Okay. हाँ जी डियर, हाँ जी, नोटबुक मैं आपको लिंक भेज दूंगा करके. और yes my dear, this part is over. Yes, everyone knows about it now. Umbilical cord, how many artery, how many vein? Very beautiful answer. We have 2 artery and 1 vein. 2 artery and 1 vein. Everyone knows about it, I guess. 2 artery and 1 vein. Yes, that's a very beautiful answer. Now I have a question. Okay, now what is this? Can you please tell me? Can you please appreciate this picture and tell me what can you see, my dear friends? Exactly, yes. So can this a very, so ये मैंने ली हुई photo. So this is very importantly, can you see 2 arteries? This is the 2 artery, very important. This is the 1 vein. We have ये जो नीचे है 2 artery like that. Okay, these two, and then we have the 1 vein. Okay, so we have 2 artery. Clinical picture, guys. Clinical picture. Exactly. Yeah. And what is this blue thing? Anyone? What is this blue thing? Yes, umbilical clamp. Umbilical clamp, very very important. Umbilical clamp. Okay, this is one thing. Okay, perfect, very good, so beautiful. People are answering, amazing. Umbilical cord has everyone knows. So umbilical cord has 2 artery, 1 vein. This is the easy question. Next question please. I'm loving these transitions. Okay, they're like crazy. Tish. It's cute, na? It's very nice. Just see, nice. Are you liking the transitions more than the lecture? I'm liking the transitions. Okay, it is always like that, you know. More than spending time on the lecture, I'm spending time on transitions, motivation quote. How should I make it attractive? How should I make it crazy? Because the lecture, though, I have read it like 1,000 times. I have read these topics from 5 different books. That's why. So yeah, can you please answer in the comment section, bro? ये क्या है यार? But I'm not able to get it. Anyone, please? Dr. Grace, very good. So the best answer, yes, exactly. Beautiful. So the best answer is, we have in this case, sir, there is 1 artery and 1 vein. 1 artery and 1 vein is the answer for this question, right? आप देख सकते हैं ये एक artery है और collapsed lumen वाली vein है. So 1 artery and 1 vein is something I can appreciate in this picture. Second important question, yeah, diagnosis. You saw the picture and can you please answer this one? So the options are congenital adrenal hyperplasia, shock, renal agenesis, and it is a normal finding. Exactly, yeah. Yes, Dr. Grace says, sir, you don't leave even a single thing in making the class interesting. That's very well true, dear. I trust me, I try my best to make the class very interactive. I try to make it very attractive also, and I think it's good way of by the grace of God, I feel I am little expressful. So I always, whatever I do in my life, I do to the fullest. If I'm going to the gym, crazy workout. If I'm teaching, crazy, like crazy, what you call it, emotions and intentions. So the best answer for this question, of course, everyone knows, is renal agenesis. Yeah, exactly. And can you please tell me one thing, one more question? Can you please, if you are the examiner, can you please make a question, any extra question where the answer is renal agenesis? One question I made, okay, if the baby is having a single artery and single vein, what will you think? The answer is renal agenesis. Can you please make one more question for me and where the answer is, kind of renal agenesis? Dr. Shubham, that's why everyone loves you, Sarji. Shubham, I'm nothing without your support. We all are one. We are one. Remember that, okay? Exactly, Dr. Amrit is right. If the mother is a case of oligohydramnios, that's good. I'm really happy you guys remember everything. That's very important. If the mother is a case of oligohydramnios, what is the defect I should rule out in the baby? The answer is renal agenesis. So oligohydramnios means less liquor. So less liquor, very importantly, liquor. How does the liquor form? The baby's urine. Baby's urine only is the baby's liquor. In a case of oligohydramnios means less liquor. Less liquor means baby passing less urine, and less urine means there is some problem in the baby's kidney. So you must rule out renal agenesis. And once the baby is born, we must do a ultrasound whole abdomen with KUB. Ultrasound whole abdomen KUB. What is KUB? I have no idea. What is KUB, bro? Yes. KUB is nothing but kidney. I would like to see the ureter and I would like to see the bladder. Bladder. Exactly. Perfect answer. Very good. Yes, Mariam is right. See, Mariam, see, if you guys have extra points, no, put in the comment section. Very beautifully, Mariam has told one amazing thing. Potter syndrome. In a case of Potter syndrome also, you can have oligohydramnios. In a case of Charge syndrome, मुझे भी एक याद आ गया, Charge syndrome. In a case of Charge syndrome, you can see very importantly renal agenesis, R for renal anomalies. In a case of Potter syndrome also, you can see oligohydramnios. Perfect. Very good. Next question, please. Okay, this part is over. Yes. Now coming to the next slot of questions. I would like to keep the PDA open. What will you give me? Try to answer as many MCQs as possible, my dear friends, because the more MCQs you solve, no, your vision will increase. The more complex, it's scientifically proven, the more complex instructions you follow and you try to clarify it down in your brains, the more Salka and Gaira you make it nicely, you will rock. You will be brilliant. And that's the definition of intelligent or genius. You know, that's what he thinks a lot. Exactly. So I want to keep the PDA open. What will you give me? Exactly. Can you give me L-prostadil? Hanji sir, you can give me L-prostadil. What is L-prostadil? L-prostadil is PGE1 analog. That is very well true. Prostaglandins PGE1 analog, if we give, it keeps the ductus arteriosus open. Can you give me PGE2 analog? Yes or no? Can you please give me PGE2? Yes or no? Yeah, the answer is you cannot give me PGE2. Why, sir? Why? Because PGE2 is endogenous. PGE2, prostaglandin E2 is endogenous. Placenta secretes PGE2. I cannot secrete or I cannot give IV, okay? Placenta secretes PGE2, but what I can give from outside is PGE1, which is nothing but L-prostadil. That's why the best answer for this question is option number D. Exactly, option number D. Very good. Yeah. And I want to keep the PDA, I want to close the PDA, bro. What is the option available? I want to close the PDA. Exactly. Yes, Dr. Amrit, very true, my dear. I want to keep the PDA. I want to close the PDA. Can you please tell me which is the best option? Options are ibuprofen, option are indomethacin. In injections, we have ibuprofen. In syrups, we have indomethacin, or A plus B are correct. Can you please answer? Very good, very good. Dr. Sumbul says D is the best option. Okay, anyone else? Someone says E is the best option. Anyone? Okay. Now remember one thing. The answer for this question, indomethacin comes in IV, intravenous. Indomethacin syrup nahi aata. There is no syrup of indomethacin, number one. So that's why saying in syrup we give indomethacin is a wrong option. Okay, it's a wrong option. Indomethacin syrup doesn't come. In injections, we give ibuprofen. That's also a wrong option because ibuprofen syrup comes. Ibuprofen comes in syrup form. Indomethacin comes in IV form. That's why option number C is out. Option number D is out. That's why ibuprofen and indomethacin, kind of A plus B, is the best answer. Exactly. Hanji. Exactly. Yes, mere bhai Amrit, true. Ibogesic aata hai, ibuprofen. Yes, the very true, bro. Okay, I have a question. I have a doubt. Sir, agar exam mein dono option aa jaye, if in exam you have ibuprofen also and indomethacin also, which option should I choose? What do you think, guys? Anyone? Quick answers, please. Which option I would choose if what do you call it? Ibuprofen also comes and indomethacin also comes. कौन सा ऑप्शन चूज किया जाए? इंडियन लवर्स इज गिविंग हार्ट. थैंक यू सो मच. एग्जैक्टली द बेस्ट आंसर फॉर दिस. एग्जैक्टली मरियम हैज अ वेरी गुड आंसर. Ibuprofen. Syrup is better. Syrup is better. Ibuprofen is the best answer. Please remember. नहीं, Indian lovers remember. Dr. Zahid. Exactly. हाँ, Priya is right. In oral, ibuprofen is best actually, not indomethacin, my dear. Ibuprofen has a very good answer. Okay, perfect. Next question, please. Next question, please. Exactly. Everyone knows this. We have already done. Okay. Okay. Yes, a very beautiful quote, guys. Yes. Can we have a quick, amazing quote? The class is coming to an end. Okay, just 2 more minutes and this class is over. I don't teach more than 45 minutes because 45 minutes I want you guys to put the best vibes in the class so that you can remember every single smallest entity also. So a quick motivating quote says in Hindi, जो निशुल्क है वही सबसे ज्यादा कीमती है. द थिंग विच इज फ्री, ओके, दैट इज द मोस्ट एक्सपेंसिव थिंग टुडे. एंड व्हाट इज दैट थिंग? नींद, शांति, आनंद, हवा, पानी और सबसे ज्यादा हमारी सांसें. डू यू एग्री विद दिस कोट? यस और नो? जो सबसे ज्यादा निशुल्क है, जो सबसे ज्यादा निशुल्क है, वेरी इंपॉर्टेंटली, वही सबसे ज्यादा कीमती है. नंबर वन इज नींद. आवर स्लीप इज रियली वेरी इंपॉर्टेंट. डू यू नो हाउ मेनी पीपल आर सफरिंग फ्रॉम डिप्रेशन? यस और नो? कैन एनीवन टेल मी हाउ मेनी पीपल आर सफरिंग फ्रॉम डिप्रेशन? Out of three to four, one is suffering from depression. Out of four students, out of four people, one is suffering from depression. So that means to say, in every family, there is one person who is suffering from depression. So something जो निशुल्क है, something which is free, is the most expensive one. Number one, हमारी नींद. Number two is our peace of mind. It's very expensive nowadays. Anand, being happy. People are not happy nowadays. You make me happy, then I will be happy. If she comes to my life, then I will be happy. If I get a nice house, then I will be happy. No, don't be materialistic. Just breathe and just happy. Be happy without any reason. Be happy without any reason. You must enjoy your daily routine. You must. Who is successful? You know that? Who is successful? The one who enjoys his daily routine, that person is successful. No, right now I'm very frustrated. Once I get a PG sit, then I will be happy. I'm very happy that you will be happy that day, but make sure you're happy today also. It's important. Okay, it's important. So नींद, शांति, आनंद, हवा, पानी and सबसे ज्यादा हमारी सांसें. Okay, these things are very free, but they are very expensive. Next question, the last question, then this class is over. Exactly. Yes, Dr. Shubham, Anand means you. Yes, Anand means us, हम है, बाकी पानी कम है. Shubhangi says Anand comes automatically in Anand sir class. Ooh, thank you Shubhangi, that's very sweet of you. Hanji, last question, then this class is over, my dear friends. Could you please answer what are the contraindications of ibuprofen in PDA? Can you please answer in the comment section, please? Ibuprofen, see, if you have to close my PDA, you will give me ibuprofen, right? What are the contraindication? Exactly. True. The contraindication of giving ibuprofen are, don't give in any idea. Number one, in acute kidney injury. If I'm having acute kidney injury, don't give me ibuprofen. If I'm having thrombocytopenia, very beautiful, told by Dr. Sona Vidyashri, very good. Yeah, don't give me ibuprofen. Number one, if I'm having, very importantly, can you please answer? Okay, I'm giving you options. Renal impairment, thrombocytopenia, necrotizing enterocolitis, all of the above, or only A plus B is correct. It's a good question. People get confused. What do you think, guys? I only told you kidney injury mein don't give me ibuprofen. Thrombocytopenia, don't give me ibuprofen. What about necrotizing enterocolitis? If I'm suffering from NEC, do you know NEC? I hope you know that. I'm gonna write it for you. Necrotizing enterocolitis. Necrotizing enterocolitis, very important, is one entity we're going to talk about. It's very easy it is. Okay, exactly. Yeah, yes, very good. Okay, perfect, very nice. Yes, 1 second. Yeah, very good, perfect. Ooh, that's right. Okay, 1 second. Perfect. Yeah. So very importantly now, the best answer for this question is all of the above. Yes. So in kidney, if I'm having kidney injury, don't give me, very importantly. Yes. And if I have me, very important, thrombocytopenia, don't give me. And if I'm having necrotizing enterocolitis, the ibuprofen is totally, absolutely contraindicated. That you should know. Okay, that's it. This part is over. We have done this. Perfect. Good people answering good. Yes. Now this is a good one. PGE1. Like how do you give root and dose? Last question. PGE1, right? We were talking about it. If you want to keep my PDA open, what will you give me? Anyone? Yes, exactly. So PGE1, right? कैसे देते हैं? Options are yes, exactly. Should I repeat? Okay. So dear, remember one thing, the ibuprofen which is given to close the PDA. To close the PDA, you give ibuprofen, right? In a case of kidney injury, don't give ibuprofen. If the patient has thrombocytopenia, don't give ibuprofen. If the patient has necrotizing enterocolitis, we are talking about the newborn baby here. If the baby has necrotizing enterocolitis, NEC, ibuprofen is contraindicated, right? Next question now. The question is, yes, we have got the option. This is the last question, guys. Thank you so much for all the love and support. You guys are amazing, amazing. Yes, exactly. So very importantly, yes, okay, perfect, perfect, very good. Yes. So now could you please answer in the comment section, root and dose of PGE1 कौन बताएगा? Yes, yes dear, I have done. Dr. Shubham अभी नजर नहीं आ रहा ना मेरे ख्याल से. Let me know bro. हाँ. So the best answer for this question, do you give this oral or IV or per rectal or inhalational? Exactly. The best answer, yes, exactly. You have done that, I guess. Yeah, so I've done that. So the best answer for this question is IV. IV is the best route. Yes, IV is the best route, very importantly. So the route and dose of PGE1 is very importantly, number one, we give intravenous, and number two, the dose is nothing but 0.05 to 0.1 microgram per kg per minute. Yes, exactly. This was the NEET SS question. This was the NEET SS question. Very very important. ये super speciality में आया था. Any one of you applying for super speciality? This was the question. That finishes today's class. I hope you guys have been benefited with this class. Has everyone understood this much? Yes or yes? Put a last like button to this video. Now this class is over. I hope everyone has been benefited little. समझ में आया या सब कुछ ऊपर से गया? Exactly, very good, perfect one, perfect, exactly. So yes, very good. Yeah, that's good boy. So I hope you guys have been benefited. Thank you so much for everyone for all the love and support. You have been amazing. And remember, please remember, just remember one thing, okay? You are the best, okay? You are the best. You must have, as a friend, if I talk to you, okay, you are the best, okay? You are the best. You were born best. हम हैं, बाकी पानी कम है. We are the best version of ourselves. We are self-sufficient. We are amazing. And we are just perfect, okay? We are just perfect, okay? Remember that, okay? Yes. Dr. Zahid says, my love towards Pedia is only for you, sir. Thank you so much. That's very kind of you. Thank you so much, everyone. That finishes this today's class. See you tomorrow again. Every day, 8:30 p.m. I just want one thing, that every day try to spare 8:30 p.m., okay? Just Monday to Friday. Little 5 days a week. 2 days, Saturday, Sunday will relax. 5 days a week, let's just quickly, nicely cover the whole pediatrics. हाँ जी, नहीं मेटाजिलो आज 11 बजे क्लास नहीं है. अब सारी क्लासेस हमारे YouTube चैनल पे होंगी. Every class now will be on the YouTube channel. Every day, evening, 8:30 p.m. for 45 minutes. Try to spare little time if possible. It will be fun. Thank you so much, everyone. Please make good biceps. Please go to gym and just be amazing.